Breaking news from Metro Santara. A severe monsoon of flooding has overwhelmed municipal drainage, accelerating silent crisis, antimicrobial resistance or AMR. Leftover pharmaceuticals from urban runoffs alongside untreated wastewaters from local hospitals are pooling in our waters. In our wet markets, unmanaged organic waste act as an environmental catalyst, accelerating bacterial mutation and the spread of resistant infections. This environmental driver places everyone from market vendors to everyday consumers at immediate risk. If left unchecked, AMR could turn into fatal illnesses.
Dad, look, it turns out AMR is actually so close to our daily life.
You're right. If our city keeps flooding and the market stay heavily contaminated like this, what can we even do? How are we going to survive?
I really hope the government does something about this soon.
Hello, we are from the Amphibio. To help Metro Santara fight the dual threat from flooding and AMR contamination, we propose a systematic system that's resilient and adaptive.
Exactly. Overcoming the crisis requires the active participation of everyone, especially key market stakeholders like you, sir.
A solution for us? Sure, let's see it.
Wet market produce amount massive of organic waste every day. If we cannot control it, it can increase the bacterials that can lead to antimicrobial resistance. To address this, we introduce our resilient urban bioforge, a decentralized black soldier fly system installed directly at wet market. Each unit features QR-based waste tracking, smart weighing sensor, and contamination monitoring cameras, and also incentive system that reward vendor for proper waste disposal. To ensure climate resilience, the system is equipped with automated hydraulic elevation mechanism, waterproof electronic, and seal latch chamber that isolate contaminants during extreme weather events. But bioforge alone is not enough. That's why we integrate it with our next solution, wetlands.
Next, the outputs from our bioforge system feed into our secondary barrier, which is the amphibious wetlands. At key point sources like hospital wastewater, we install solar-powered aerators to inject massive amounts of dissolved oxygen into the water, accelerating the breakdown of pharmaceuticals residues by native and beneficial bacteria. This solar setup generates local green energy to power not only the aerators themselves, but also the smart sensor and environmental monitoring systems that track water quality in real time. Next, the water passes through floating wetlands. Here, we use vetiver grass roots and biochar filter, which are actually made from the recycled waste from our bioforge. This biochar acts like a magnet, trapping leftover antibiotics so they don't enter our food chain. And the best part of it? This system keeps working even during monsoon flood. Once the water is treated and safe, it doesn't go to waste. It is redirected to support Metro Santara's green zone. But then, how do we know where the risks are spreading? We could know it through the wastewater-based epidemiology. Every day, municipal drains carry pool signatures from hospitals, factories, and households. By reading this wastewater, we get objective, passive data even before anyone visits the clinic.
We deploy IoT sensor nodes across 5 critical zones to monitoring pH, dissolved oxygen, and turbidity 24/7. We use a two-window approach. The dry season establishes our environmental baseline, while the monsoon season triggers adaptive sampling based on meteorologic alerts.
When sensors flag an anomaly, our two-tier dynamic surveillance is activated. Tier 1 provides rapid field inspection, then alerts are escalated to Tier 2 for comprehensive resistance mapping, which is processed by 3 AI models that assess zone risk, identify new mutations, and translate each alert into information.
To confirm monsoon-induced dilution, our AI applies flow-based normalization that measures the actual hourly mist load.
We use 5 upstream data streams feed 1 AI engine. Then, to protect institutional data privacy, we use federated learning. Compliant facilities earn the tiered Santara Green label, feeding directly into WHO glass.
Every layer, which includes VB alerts, genomic result, food prediction, data streams, and governance core, is integrated in Santar AMR Watch.
So, how does this connect within the One Health framework? This Amphibio is the One Health system, not for parallel programs but for bidirectional loops. Urban Bioforge addresses animal-human interface. Floating treatment wetlands manage environmental pathways. And the public education change human behavior at the source. And the Santar AMR Watch platforms integrate surveillance from all sectors. 4 pillars, 4 domains, 1 system. And our plan aligns with international standards from the WHO Global Action Plan on AMR, the One Health Joint Plan of Action 2022 to 2026, the UNEP's 2023 Bracing for Superbugs, the WHO GLASS 2025, and FAO Renofarm.
The main benefit of the Amphibio is integrated with the One Health approach. Besides that, it can reduce the risk of the AMR, resilience to the floods, and of course, it can support public health sustainability.
However, the Amphibio requires strong stakeholder communication, continuous funding, and long-term community participation. That's why we have to involve everyone's participation.
This is the Amphibio roadmap budget. This is our key performance indicators. And this is our stakeholder.
After year 4, every pillar's transition into a long-term sustainability. Our 10-year financial model shows cumulative net benefit achieving $42.4 million, achieving a benefit-to-cost ratio of 3.27. We project a realistic BEP at year 5, accounting for necessary lag time in infrastructure deployment and community adoption. After year 4, maintaining the entire system costs $1.2 until $1.7 million per year, compared to $5 until $15 million for a single AMR outbreak response.
That's impressive, but can people like us actually be part of this?
That's exactly the point, sir. Our system cannot work by itself. We need the society to work with it.
Technology alone is not enough for AMR. That's why we provide the community through collaboration and education. We provide training for farmers and wetland resellers about safer sanitation, waste management, and BSF system.
Not only that, we also have the AMR Awareness Week. The youth volunteer will be spread the information during this week. It will be held at least once in a year. And then, to enhance the community, we also provide the hall of information in our application. It including education, information, tips, and everything about the AMR awareness.
To encourage wider participation and make education easily accessible, business and market with good AMR safe practice can receive an AMR Santara label to inspire others.
The biggest benefit in our system is the real change start from the ground. People can start to changing their behavior so it will be more sustained. But we know that changing it not only in one night, it can take like 18 until 24 months. So that's why our community education starts as a day one.
Because protecting wetland Santara is not the responsibility of scientists, government, or technology. It starts with all of us.
So don't forget to participate in the Amphibio.
Absolutely, I believe the system protects our market, our city, our health, and it deserves everyone's full support.